My name is Heun. I'm a consultant psychiatrist and old age psychiatrist, and I'd like to talk today in our series Global Psychiatry Archives, Mental Disorders Explained, about normal aging or the challenges of normal aging, and first about the brain. Usually the weight of the brain reduces by 5% between 30 and 70. And by the age of, up to the age of 80, it's about 10%. And by the age of 90, you will have lost about 20% of the brain volume. In contrast, you will have more subarachnoid space, and the spaces between the area of the ventricles is getting bigger, and so there's more liquid flowing around the brain. So that's called the subarachnoid space. This is shown in MRIs, and you can see then in the MRI that the gray and white matter reduce a bit. This is most prominent in the hippocampus. That's a brain region which is usually related to memory. Association cortex, which is also related to memory, most likely more to long-term memory, and the cerebellum. And on top of this, the blood flow, when you measure it, is reduced in the frontal and temporal lobes on the side in the front, and in the thalamus, which is inside the brain. So the blood flow goes down, specifically in some areas. And then this is reflected by the loss of specific nerve cells. So some cells go in the cortex, so it's in the area around the brain. The hippocampus, which is in the middle of the brain, as I said, related to memory. And the substantia nigra, which has some relationship to Parkinson's disease. And some specific cells, Purkinje cells of the cerebellum, which connect to other brain parts. And these reductions are associated with reductions in the spikes of the cells, or dendrites and synapses. And as a long-term problem, we have changes in the cytoplasma of these nerve cells that when proteins decay, they have different types of accumulation of proteins and fat in the brain or in the brain cell. So this could be lipofuscin, which are accompanied by changes in the cell skeleton, tau protein, which has been related to Alzheimer's disease, which are neurofilaments and microtubules, can make neurofibrillary tangles, and neurofibrillary tangles are usually in the normal person, or in the normal brain, normal elderly brain, only seen in the hippocampus and in the entorhinal cortex. There are senile plaques, which are related to amyloid, and they are found in the cortex, amygdala, hippocampus, and again, entorhinal cortex. There are other protein accumulations, which are Lewy bodies, which are usually accumulated in the substantia nigra and locus coeruleus. And Hurano bodies, they are more in the hippocampus, and then you can have amyloid deposits inside and outside of cells. And sometimes these amyloid deposits go into the vessels, more or less. So you have in summary, you have a bit of a mixed picture. You have a general cell loss, you have wider cerebrospinal fluid spaces or subarachnoid spaces, and wider ventricles, and usually different types of proteins, or fats, which decay in the elderly cells, accumulate in more or less slightly different areas in the brain. So what does it usually mean to the brain itself or to the activity of the brain? It means that the cognition goes down at the age of 25 already, but consistently after you're 70. And that's very bad for me then. See what happens, you know. And usually the IQ is best when you're 25, but you know, it usually stays the same until 70 and then goes down. Usually there is a difference between performance IQ, which is what we do and how we can do things, and this is then different from what we call verbal IQ. It seems that the language function is quite stable, and what we call crystallized information and performance IQ is more or less based on working memory, working with memory, changes from information. So the old information is kept, but dealing with new information and manipulating new information, that's performance IQ, is more going down. Problem solving deteriorates, and there's affected by short-term memory changes, but also by changes in abstraction. Long-term memory may decline, but usually it's kept for the long-term events. Sometimes some people say the memory is like a basket, you know, like a waste basket. What's go in first comes out last. Right, okay, so not talking about other physical things like heart and liver and the lungs. We stuck to the neural system or the brain system. Usually there's a psychomotor slowing, so it's not just that the bones are whatever but older, but it's also the nerves which make the body move, that are more or less working slower and can cause psychomotor slowing. And however, when things are well rehearsed, things, you know, can be quite stable and show very little decline. So that was the neurobiology and the psychology or cognition. When you look at normal aging, there are problems which come down whether you want it or not. People die, increasing numbers of elderly people live alone, and this has to do in some countries with the loss of numbers of families or the breakdown of traditional family structures, that people don't live in generations but live more or less independently. There are losses in life, loss of status, loss of independence, loss of health, came to that. There are loss of friends due to death, and most elderly people are living, or many elderly people are now living alone without their partners or spouses who might have died, and physical problems might make them a little bit more dependent on others, care needs coming in, and there's more isolation, marginalization, and stigmatization. So life isn't nice for the elderly, but that's how it is. You can't change it, and you can adapt. Luckily, it's not always the same, and people can do something, and there's something about healthy aging. But to be realistic, it's more or less about adapting to older life than thinking that one can have youth forever. Right, I hope this little story about normal aging didn't affect you too much. And if you're interested in hearing more about mental health, then subscribe to our channel or like our channel, and let us know what you're interested in, and we will have a look at that. Thanks for your interest today, and goodbye, and see you soon.